Baby girl E is a 2-month-old infant, date of birth 7/9/15, who presents today with both parents for her 2-month well checkup. She was born at 36 weeks gestation to a 30-year-old mother, G1P1. Only medication she's taking is Mylicon drops, PRN for gas. Mom received routine prenatal care throughout her pregnancy and had no complications during pregnancy. The only medicine she took was a daily prenatal vitamin. She denies use of cigarettes, alcohol, or illicit drugs. Her blood type is AB positive. She tested negative for hepatitis B surface antigen, HIV, gonorrhea, and chlamydia. Her first and quad screens were negative, VDRL non-reactive, and she's rubella immune. She did test positive for group beta strep at 35 weeks and was treated intrapartum with IV antibiotic. Spontaneous rupture of membranes with clear amniotic fluid occurred 3 hours prior to delivery. The baby was born a spontaneous vaginal delivery in the cephalic presentation. APGAR scores were 7 at 1 minute and 9 at 5 minutes. She just required bulb suctioning and tactile stimulation. She had an uncomplicated course in the hospital and went home on day of life 3 with Mom. She received her first Hep B immunization and passed her hearing screen in the hospital. She has no allergies and her history is negative for any illnesses, surgeries, or infections. Mom is 30 years old and healthy. Father is 31 years old and also with no significant medical or surgical history. Maternal grandfather has hypertension controlled with medication, and paternal grandfather has a history of MI and CVA, no residual. The grandmothers are both alive and healthy. There's no family history of SIDS, congenital anomalies, genetic problems, diabetes, respiratory disease, neurological disorders, or psychiatric problems. The infant lives with both parents in a house with 2 dogs. Both parents completed education through high school. The dad is employed at a local furniture plant, and Mom will return to work full-time as a grocery store clerk in 4 weeks. Both sets of grandparents live nearby and are supportive, and the paternal grandparents are going to watch the infant while Mom returns to work. The infant sleeps in a pack-and-play in parents' room. They have both working carbon monoxide and smoke detectors. There is a risk of exposure to secondhand smoke as the paternal grandfather smokes but does so outside. No lead exposure. The house was built in 1983. They have well water, no guns, weapons in the home, and they are comfortable in care of infant at this point. Mom is currently on an oral contraceptive to prevent pregnancy. Baby girl is exclusively breastfeeding every 2 to 3 hours during the day, with an exception of a 2-hour period every night when she feeds hourly. She has approximately 10 to 12 wets every 24 hours, as well as 4 to 5 stools a day. She usually has an uninterrupted sleep at night for 5 hours, and then takes multiple naps during the day, and she is appropriately smiling and cooing. And there is improved head control both during tummy time and when she's being held in a sitting position. The only problem the parents have noted is that she has a period every night where almost every night where she is difficult to console. The only thing that works is consistently holding and rocking her. Other than that, they have no concerns at this time.